Welcome to HSS Presents, the podcast of Hospital for Special Surgery.
Welcome to HSS Presents, the podcast for the Hospital for Special Surgery. Our podcast is your trusted source for educational conversations on advances in musculoskeletal science and health and best practices in patient care. My name is Dr. Stephanie Chen, and I am honored to be the host of this episode. I'm a board-certified anesthesiologist that specializes in regional anesthesia, but I'm also fortunate enough to be trained and board-certified in medical acupuncture. I serve as the director of the perioperative integrative medicine program at HSS, and I specialize in the integration of non-pharmacologic and novel modalities in the perioperative period for orthopedic surgeries as part of a multimodal approach to postoperative pain control and overall recovery. I'm so excited. Here with me today is Dr. Veena Graff. She is an associate professor of anesthesiology and critical care at the University of Pennsylvania Perelman School of Medicine in Philadelphia. And she serves as the division chief and fellowship program director for regional anesthesiology and acute medicine at Penn. She's also the perioperative pain management lead for Penn Medicine's opioid task force. Her research and interests have focused on the benefits of music medicine in the perioperative space. And I'm so excited that she's here with us to discuss her work. Thank you, Dr. Veena Graff, for joining me today at HSS Presents. It's funny because looking at our trajectories, it seems that we were on kind of a parallel timeline for using our respective non-pharmacologic treatments and published around the same time, but we didn't actually get together or chat until earlier this year at our national conference. And I've kind of known about you and have been on panels with you prior, but I think this was the first year that we really sat down and got into the weeds of it. And I think that getting together with people of sort of like mind, it's very important because seems like we're all kind of like a little bit siloed, doing great works in our respective academic bubbles. And so I think that by combining sort of our superpowers, especially in the space of non-pharmacologic modalities, is really important because they can all be so synergistic.
Yes, agreed. I think, first of all, I wanted to say thank you so much for having me on this podcast. And yes, you're right. We've crossed paths so many times. And I think the last conference that we really had a chance to sit down and talk, you're absolutely right that there's not many people who are into the holistic arena, especially in the field of anesthesiology. And it's funny enough because in anesthesia, we talk about making sure to offer comfort and give a good patient experience. And you and I both have this unique avenue with your acupuncture and my music medicine research. So I think it's very cool that we connected, and I think it's cool that we get to share this stuff with the population out there.
Yeah, I don't think we actually said Dr. Graff is actually an expert in music medicine. And so, before meeting you, Veena, I actually hadn't really heard the concept of it. Could you explain a little bit to our audience and sort of a bit of the science behind why music can really help in the perioperative period?
Yeah, definitely. So it's important to distinguish first thing between music medicine and music therapy. So music therapy, which people often get confused, is actually a therapeutic type of approach that licensed music therapists actually offer to patients as an intervention and treatment, versus music medicine, which is what I focus on, is patients listening to music in a clinical setting in a passive way, either by headphones or by speakers. So that's the number one distinction that people need to make. And there's been loads of research out there that have shown that when people listen to music in a clinical setting, especially in the world of perioperative medicine and surgery, they're in a vulnerable state. So music just helps them relax and calm before they actually go into surgery and even after surgery.
That's so interesting. I mean, who knew that, music can affect the brain so powerfully? And you're right that each person responds to music so differently because no two brains are the same. So it makes sense that if we're just walking down the street, we're all kind of bopping and chilling to a different type of music. Do you recommend a specific type of music for your patients in the perioperative period?
Yeah, so first of all, every person listens to music and they have their own feelings with it. So if a person has a choice, then so be it. Because what I may listen to that helps relax me might not be the same for you, and vice versa.
Yeah.
So, patient choice is totally fine in that clinical setting, especially if they know their specific tracks or songs or albums that help relax them. But for the person that doesn't really know and they're asking you as a physician, like, hey, what do you recommend I listen to in this state? I'm really anxious. You can always recommend music characteristics that have low beats per minute, no lyrics in the in the actual song, no fluctuations in percussion, and no abnormal sounds that really just kind of like alert somebody in that Zen moment. So
Yeah.
those are some
So not like
characteristics that
heavy
we definitely
metal.
listen to.
Yeah.
And again, like if somebody feels that heavy metal really helps, like, I don't know, calm them,
Yeah.
then so be it. I
I
mean,
mean,
who am I to
yeah.
say?
I mean, if you think about house music, it's very percussive. It's very, like beat for beat kind of versus something like, I don't know, like a samba that has a little bit of a fluctuation. I guess you're right though. Like I feel like things that, and it's like time sensitive for me too. Like sometimes like a really soothing classical music will be very relaxing. And other times I'm so annoyed with it because it's so, I don't know, like not different enough. I don't know. I
Yeah,
think it's different.
absolutely.
Yeah. Cause the
Absolutely. And
brain,
then
yeah, go
go
ahead.
ahead.
No, so I
Sorry,
think
go
like
ahead.
no, you were mentioning that I think that the music like affects the brain differently. Like what are some of the pathways that music goes through?
Yeah, so when somebody listens to music, it lights up the limbic system, and that's our emotional center of the brain. And then there's neuronal projections from the limbic system to the hypothalamus, which is the center where it controls our heart rate, our respiratory rate, our blood pressure. So, when you listen to that specific song, it's no doubt that if somebody listens to it, their heart may jump, or their heart kind of relaxes, or their respiratory rate relaxes, or their blood pressure increases or relaxes. So, these are the things, this is the reason why there is true, real science behind when listening to music. It actually lights up parts of the brain that helps people feel relaxed or pumped up and so forth.
Yeah, I mean, that's fascinating. Do you think that music is comparable to some of the medications that we use in the perioperative period, like midazolam, which is like something that decreases anxiety that we often give in the like, in holding before we go into the operating room?
Yeah, so we did a research study that's basically we compared music medicine to giving midazolam prior to performing a nerve block, which we routinely do in the preoperative setting. And then we tested the change in anxiety state from before the intervention to after the intervention between the two groups of midazolam and music. And what we found in our research study is that there was no difference in the change of anxiety state from before to after. So, and there's been loads of other studies that have been done too, where, we did an intervention with nerve block. There have been many, many studies where they just looked at just receiving midazolam in the preoperative area where people are normally a little bit anxious. And the point of this is, everyone is different. And, we already know in the world of anesthesia that medicines can alter and reduce heart rate, respiratory rate, blood pressures, and so forth. But if there was a non-medication route that we can add into the mix, why not do that? After all, these medicines may have an undesirable side effect, or some people just don't really like the feeling of that medicine.
Yeah, yeah. I mean, I don't know about you, but a lot of my patients are saying, I want as least amount of medications as possible, especially now that we're moving towards ambulatory surgery where patients need to go home the same day, or we want them to go home same day because we found that the outcomes are better if they recover at home the first day. Decreasing the amount of total medications that the patient receives within their body is just one more step into getting them home earlier. Um, this is interesting.
Absolutely.
Like, I mean, you're definitely the expert in music medicine in the perioperative period. Can you explain a little bit more about your study that you did with the nerve blocks? Like, patients were getting, music. Did they pick their own music? Was it a standardized thing? What go into a little bit more about that?
Yeah, so in our study, we actually ended up choosing a research selected music, and it was by this artist named Marconi Union and his track named Weightless. And this song was, featured in Forbes magazine, that it was deemed as one of the most relaxing songs in the world. And what they did was that they collaborated with sound therapists at the British Sound Academy and constructed and produced a song that had components of it that reduce heart rate, reduce respiratory rate, reduce blood pressure. Then they had a series of healthy volunteers and they tested the song that also showed those outcomes of reduced blood pressure, heart rate, and respiratory rate. And in fact, the funny thing about this one track is that they actually recommend not listening to it when you're driving. It is that powerful.
Really?
So,
Wow. Okay. So definitely
so
not
that's
post
one of
call. Definitely
no,
not post.
it's definitely not post call.
Okay.
So that's one of the reasons why we chose it, because we were like, you know what, let's just try this song out, compare it to IV midazolam that we routinely give. And mind you, the dosage that we give IV midazolam before we even do a nerve block it is very little because, of course, when we do nerve block, we want the patient to be awake and communicate with us to reduce any nerve injury, nerve damage, and so forth. So that's the reason why we chose that song, to try to simulate essentially what it could do, similar to IV midazolam.
Okay. Okay. What was that song again? I'm going to look it up afterwards.
Yeah, it was Marconi Union,
Okay.
and the track name is Weightless. It's like a very, very long track, like over 10 minutes long, and it's like very soothing.
Yeah.
I remember the day when I actually decided to, I researched it and like
Yeah.
picked that song. I had my wife listen to it. I was like, "Hey, just take a listen to this and let's see what happens." And literally within like 5 minutes, we both were out. We both
Oh
fell
my gosh. Oh
asleep.
my gosh.
So, so anyway, we're
That's
like, okay, yeah, that's it.
Yeah, that's amazing. So did you have them wear headphones, or was it something that they listened for the full 10 minutes? What was the
Yeah, so basically we had them had noise canceling headphones over the ear is what we had them. We actually had Bose noise canceling headphones on for them. And we, wanted to simulate as close as possible what happens in the real world.
right?
Typically, whenever we give something like IV midazolam, we wait 2 or 3 minutes before we actually do the nerve block. So we're like, you know what? It wouldn't be a fair thing to say, hey, sit here and listen to the song for 25 minutes and then versus like IV midazolam, which literally takes effect within minutes. So we wanted to see something that would be most simulating and see if that could actually produce the same effects. What they say about listening to music medicine is that it is very beneficial if you listen to it at least 15 to 20 minutes ahead of time. But we knew we didn't have that type of luxury,
Yeah.
especially in an ambulatory surgical center. And even though if we could show good outcomes, it's not realistic in the real world. So we really stuck to 3 minutes of listening to that track before we started the nerve block versus giving IV midazolam and waiting 3 minutes for the IV midazolam to take effect. And the surprising thing was that the change in the anxiety state from before to after was no different between both groups, which I thought was really cool.
Yeah, that's fascinating. Like having the exact same or no difference between the IV medication that was given, something that can affect the rest of your body, not just your relaxation state, and just listening to something as innocuous as music, and potentially have a lot more benefits with it, without having those side effects. That I think that's fascinating, and I think patients would really be certain select group of patients would be very interested in. And other, some people who have baseline anxiety and diagnosed, PTSD and things like that, this probably wouldn't necessarily be.
Yeah, so actually,
Yeah, go ahead.
right. In this study, actually, we excluded those that were, diagnosed with general anxiety disorder, anybody who takes anxiety medications at baseline, because, I think in those select populations, it's really tough to kind of do something like this because they are treated pharmacologically to help with that.
Yeah.
So we excluded those things. Also, things like PTSD or, schizophrenia, any kind of like serious more severe mood disorders, we did exclude that.
And it's good to say that because we're not saying, so we're both in the non-pharmacologic, sort of space, but we're not saying that this is replacing something that patients might potentially need depending on what their comorbidities are. For some patients, if they have, for example, a quote unquote cough, fluids and rest is going to work. But if it's like a bacterial infection, they definitely need medicine. So we're going to treat patients as, based on what they need at that moment. But if you can decrease the amount of total narcotics and or, anxiolysis that they need through pharmacology, why not? Why don't we start there instead of going directly to the medication? So I think that's fascinating. Do you think that in the future you would, I don't know, leave the headphones on during the block itself?
Yeah, so there's been tons of studies that actually evaluated music medicine in the pre-op period, in the intra-op period, and post-op period. So pre-operative, like we just talked about during the session, is that it can definitely reduce anxiety, even reduce the need for things like IV midazolam. In the studies that have showed music being listened to during the intra-op period, especially those surgeries that require anesthesia where it's just sedation or monitored anesthesia care, or what we call MAC anesthesia, or sedation while you are under a primary regional anesthetic like spinal anesthesia or even a nerve block, you can reduce the amount of medication required for sedation while you're listening to music throughout that entire period. Now, for those under general anesthesia, there have not been, any reduction in the amount of general anesthetics that you would need. And partly because, I think that has to do with the evoked potential. So we talk about this whole concept of evoked potential, not a concept, but, this is what our brains are wired to. Our ears are our auditory evoked potentials are the most resistant. However, why is it that we cannot hear or remember when we're under full-blown general anesthesia? Well, because our brain processing the general anesthetics and the being rendered into an unconscious state alters that processing, which is why we wake up and we don't remember the actual surgery. Even though our auditory evoked potentials, they're fairly resistant to anesthetics. So even though we can technically hear music, we don't process it, which is why we have not seen any data that it may reduce the amount of general anesthetics that are being used in the intra-op period. But then we go on to the post-op period. And again, patient is awake, but they're sleepy or drowsy. And again, that's another perfect opportunity when you're listening to music. Maybe you can reduce the amount of opioid medication for pain control or reduce the amount of anxiolytics to help with anxiety after when you wake up.
Yeah. I mean, this is fascinating. Like just listening to you, I'm already like feeling myself relax and my heart rate coming down. You have such a great voice. Do you like Penn has been at the forefront of this, but do you know of any other institutions that are doing this?
Yeah, so actually, my alma mater where I was is University of Vermont Medical Center in Burlington, Vermont. And so I was fortunate enough to obtain a grant while I was there where we were able to purchase noise canceling headphones. So we could offer that feature to patients whenever they come into the perioperative space. Now, every policy is a little bit different. So, like, for example, and we can talk a little bit further about how to implement such a thing. But at the University of Vermont, they allowed patients to bring in their smartphone devices or media players in the intraoperative period. They kind of deemed it very similar to like wearing dentures or wearing earrings if it's possible, or rings if it's possible. So they allowed stuff like that. Not all institutions allow that. So the main thing that we really purchased and we really focused on was purchasing headphones. So in Penn, for example, they don't allow personal items like that into the intraoperative space. So again, we purchased headphones, but nowadays, anywhere you are, pre-op, intra-op, or post-op, there's computers. So it's very easy to just connect the headphones to the computer and play Spotify or play any kind of music portal that you would like to.
Yeah. It's funny. So at HSS, we play music in the operating room, but I don't feel like I would want to play this if for the entire OR to fall asleep, being that relaxed. So I think, in terms of getting the headphones, it'd be really great. So it's funny, like this whole idea really started because I had a patient like in the last 6 months or so ask for music in the operating room, but we actually weren't really set up for it. So going back to what you were saying about recommendations about how institutions would implement such a thing for patients, that is very like the side effects are so low and the benefits could potentially be so high. How would you recommend going about starting something like this?
Yeah, so first and foremost, when we talk about listening to music, it's most advisable to do it via headphones in the perioperative space, mainly because when you're playing music out loud, and even like in the operating room area, it contributes a lot more to noise. So, noise in the operating room is a very real thing, and there's tons of research on that whole arena. So it's just advisable to have it more personalized to the patient in their headphones so that it doesn't disrupt workflow for the anesthesiologist, the surgeon, and nursing staff as well, and just contribute to noise in general. I think we can all agree that in, like, for example, orthopedic rooms, I mean, noise is already at baseline so high just for the nature of the surgery. And then adding other things, like we need to listen to our alarms on the monitors and people need to communicate. Adding music in the mix, like I know people do that, but that's definitely not what I'm talking about. It's more about listening to music through headphones. So going back to your question about implementing, I think, like, again, number one is to figure out what are your policies in the hospital setting. Like the two examples I gave in Vermont, they were okay bringing smartphones. At Penn, they're not okay bringing that. Number two, like when you purchase headphones, there's two options. You can buy headphones where you can use reusable ones, where you just wipe them down, very similar to wiping down blood pressure cuffs, pulse oximeter cables, EKG lead cables. And the type of headphones I would recommend in that setting is over the ear. So it's not actually going into the ear canal, like earbuds type of headphones. And that's easy to wipe down. But the one downside of wiping them down is that over time, it's going to get wear and tear. and then may destroy the headphones. So then in that setting, you can purchase disposable headphones, very similar to the airline industry,
Yeah.
where they offer disposable headphones for longer flights. And the whole reasoning is, when you're taking off, landing, or turbulence, those are very stressful moments for anyone. And this is just a great way to distract them in those moments. So that would be the second thing to figure out: do you want disposable or reusable headphones? And then the third and final thing, like I said, depending on what your policy is, you can just either have the patient bring in their smartphones. I mean, nearly now, several years ago, Pew Research showed upwards of 92% of people across the country own phones. And of the 92%, over 70% own smartphones. So music is so ubiquitous. And this was years ago. I would think that those numbers are a lot higher right now. And so it's easy enough to like tap into music at that in people's smartphones. And if not, you have your computer right next to you that you could easily hook up to.
Yeah. Yeah. I think it's everywhere now. I can't, I don't know if this is, good or bad, but I can't really tolerate the silence anymore. There has to be something in the background for me just to function in daily life, except when I'm sleeping. Maybe that'll change too. Do you ever, just, for logistics reasons, would there ever be an issue with, like, let's say the Bovie, right? Because I get asked a lot about acupuncture needles. Is that going to burn the skin if I have them in while a patient, the surgeon is doing cauterization with the Bovie, things like that? Or is it just far enough away?
Yeah. Yeah. So the thing is, number one, it's far enough away. Number two, this is why I kind of really recommend over-the-ear headphones, so that it's nothing is like in the actual or near the outer area of the ear canal. Number three is, for patients that have hearing aids, I mean, you can absolutely still play music. And if you have headphones that are over the ear, it's easier to do that. So in all those settings, you have nothing sitting within the ear that would be concerning that a Bovie would cause some kind of electrical issue, because it's no different than your EKG lead cables, pulse ox cables that are just lying on the patient and they're moving away during the surgery. But I think when it comes to like earbuds, I think I would just take a little bit more caution in trying to go away from earbuds in these settings. And also just from the comfort of having something within the ear, even though it's obviously not that deep, but it's just even having something in the ear, it might feel uncomfortable when the patient then thereafter becomes awake and saying, there's something in the ear, I don't really know what it is.
Especially if
So
they're like
yeah,
lying on their side or something, for like a total hip or whatever. I mean, this is
right.
also fascinating. Where do you think that the future of music medicine research should go, or, just clinical practice in general?
I think there's plenty of evidence to show that music relaxes people, that I'm not so sure if you really need more and more studies to show that. It's been around for decades. I think now where the efforts should really be made is really implementing it on a global scale. And what I mean by implementation, and kind of like what you said earlier about your acupuncture, definitely would never force this upon anyone. I use the example, kind of like the warm blanket example. We offer warm blankets to patients because, number one, it just feels good.
Yeah.
But if the patient has full right to refuse, if they don't really want a warm blanket, you're not going to sit there and take a warm blanket and smother them with it. You're going to
Yeah.
be like,
Might
oh,
judge
okay,
him a
yeah,
little
no
bit. You're like,
worries.
why wouldn't
Yeah.
you want a warm blanket? Okay.
But it's the same concept. Like, music, it makes us feel good, but sometimes people just may not want it, and it's okay. It's
Yeah.
not the purpose of pushing them on it. Similar to the airline, headphones are offered, but sometimes people just tuck it away and they're like, I'm okay, but I'll just keep it there. And so it's the same concept. I think the research should really be focused on implementing it, having it globally available, because, hospital settings, peri-op settings, it's stressful to say the least. Even though we ourselves are healthcare, when you flip into the patient side, I mean, it's stressful. So it doesn't matter how well versed we are in this health system. When you are a patient, you do have moments where it's really, really uncomfortable, vulnerable, and anxiety provoking. So I think I would say that it's important to kind of implement, research initiatives to try to implement this whole feature rather than doing yet another study like whether it helped or not. I think we can all
Yeah.
agree that it helped. The one thing about music, it's a lot of it is subjective. The objective piece of it is the heart rate, respiratory rates that may or may not always show, because like we talked about earlier, everybody has a different feeling when they listen to a certain music piece. But subjectively, it feels good. And you're not going to find slam dunk type of research where, like, if somebody got a blood pressure medicine, it will reduce the blood pressure no matter what.
Right.
We're not going to see such strong type of research studies like that. So to continue to do more studies like that. I just think we might be missing a bigger piece of it. And I think we should just be focusing on more about implementation at this point.
Yeah. Yeah. So I mean, implementation studies are a big and hot thing now anyway. So I think maybe that's the direction that you seem to be thinking of, just like logistically, how can we get this out? Because again, it's the cost of the headphones and then really just offering it to patients. I mean, that seems
Yes.
that seems to be, and then, of course, institutional regulations and things like that for safety, of course. I mean, this is just fascinating, and I think it's one of those things. I feel like the space that we're in, this non-pharmacologic space, where, if you have high blood pressure and you give metoprolol, everybody's blood pressure is going to go down because we all have the same receptors, but we don't all have the same brain. So everybody's going to respond to it just a little bit differently. And so you're going to get all these, I don't want to say strange, but just varying responses of what gets people going, what gets people like the heavy metal, right? Some people are going to find that incredibly relaxing. I will find that incredibly grating and like, get it off me, get it off me, get it off me kind of thing. And I think
Right.
it's just so different. I don't know. I think it's fascinating. And then
Yeah.
again, the brain is like the last frontier that we're trying to figure out things. And I think a lot of these non-pharmacologic methods that we're trying to utilize, like meditation is big now too, and mindfulness, that can actually affect sort of not in its by itself in a vacuum, but like in addition to everything else that we do. So, really doing it
I
in
think, and I think that's the right. And I think that's the hardest part, where people are just a little bit um slower to adopt these principles. Because the thing is, in especially in like in Western medicine, like we're very, very much like, okay, here's a medicine, it does this, yay, or like
yeah.
we'll continue on. Um, but unfortunately, like these kinds of methods, like all holistic methods, to be very honest, like even acupuncture, meditation, Reiki, art therapy, music medicine, like all these different things, there is a very strong subjective component, and the objective component is not always that slam dunk. So you sometimes have like purists that are like, well, this didn't do this. And it's like, well, you just have to remember like everybody's different. And again, like I'm not only am I board certified in anesthesiology, but I'm board certified in pain medicine. So a lot of my chronic pain patients, when they are seeking what other modalities to help alongside their whole entire pain management um, therapy, these kinds of holistic maneuvers are very, very helpful. And I always find myself, again, like my arena is music medicine, but I can't confidently speak for like meditation or art therapy, but it's the risks are virtually so low that
So
you
low.
might as well just go try it and see if it helps you. And that's what I always say to patients, like, I can't tell you whether it's going to help you or not, but the risks are low enough that I would encourage you to go ahead and try it.
Exactly.
And a lot of times people are surprised with their own selves that it actually helped them. And they're very thankful that I even, put that seed in their head, like, hey, go try this out, because they would have never thought it would actually help them.
Yeah, I know. I think that's fantastic. I think we need more of those kind of approaches, especially, I mean, in your patient population with their chronic pain, there's definitely something there where it feels like by the time they get to chronic pain, they've tried everything that is,
Hmm.
sort of mainstream in terms of Western medicine. So you have to kind of go a little bit outside of the box to maybe try, because if you have pain and you go get your injection and it works, great. You're not going to look for anything else. But if you get your injection, then you tried your opioids, and then you get a repeat injection, you get some surgery, and then you get another injection, you do some physical therapy, nothing works, then we're going to have to look for something that's a little bit outside of the conventional box. I don't want to say outside of the box completely, because, I think
Yeah,
we're in the box. I think we're somewhere in the box, but it's just outside the conventional box, that patients can definitely benefit from. Um,
absolutely.
yeah, this is I think there's going to be more and more of these types of things that we're going to be looking at. Again, we both believe in Western medicine. We're anesthesiologists. We went to med school. I believe in that. I'm just saying that there
Yeah,
should be other things that we can add for patients that, may or may not have responded fully or have tried everything in a conventional way. And I say conventional because it's just what we're exposed to in medical school. We haven't gotten to the
exactly.
point where we're doing stuff like that's a little bit more holistic, Eastern, whatever word you want to use, complementary. I never want to say alternative
And
because it's not an alternative. It's
yeah,
a complement.
right. And I think that's the key thing is here, the whole moral of the story here is, obviously exactly what you said. Obviously, I believe in Western, medicine. It has advanced, medical therapies beyond what we could ever imagine in our lifetime. But at the same time, I don't think we can completely discredit some of these holistic mechanisms that have been around for thousands
And
of
proven
years.
to work.
So and then have worked. So
Yeah.
I think what's unique about individuals like yourself and me and people that do practice Western medicine, but also are open-minded enough to tap into these holistic avenues, is that what if it could be even better when you combine the two? And never saying that one replaces the other or vice versa. It's just like, why not combine the two that can make it even better? For thousands of years, the holistic methods have worked to their best of abilities, but obviously there were areas that that weren't able to advance, like for example the creation of antibiotics. I
Yeah,
mean,
correct.
like completely, or the creation of anesthesia. These are things that have moved medicine where we are today. But now we have those, so now why not incorporate it more to make it even better experience for patients in general? And that's, like, I think what my whole motto is at this point.
Yeah. No, they're not enemies. They're in, they're complementary.
Correct.
Integrate them, and we can help even a segment of the population if we can decrease the total amount of pharmacology that we're using. I think it would be great, and especially something as harmless as music. Everybody loves music. You find me one person
Correct.
that doesn't like music, okay, fine. You're the segment of the population that wants complete silence. Great, perfect, and that'll work for
That's
you.
fine.
But
Yep.
the vast majority of the population, I think, if they got to choose their music that would relax them, and I think everybody does have like their go-tos, it would be, I think it would be great. And so I think implementing something like this is it sounds, based on what your experience is, sounds pretty simple. You just got to get through some of the credentialing, or sorry, not credentialing, but the rules and regulations of the institutions that you're at. Why not? I think
Yeah,
patients really
I
like.
agree.
Yeah.
I
Yeah.
agree, definitely.
Veena, it was so nice to chat with you today. I mean, it's always nice to chat with you, but it's so nice to chat with you today, sharing some of your expertise on music medicine, and look forward to seeing what you have coming out next. And maybe we can collaborate further with the HSS patients, and
Absolutely.
do more with music therapy and or rather music medicine, not music therapy. Any last words that you want to leave our listeners with?
Yeah, I think we just all need to be a little bit more open-minded with these approaches that have been around for decades, thousands of years and beyond. And I think the whole point is just like we can easily incorporate it within Western medicine. And I think we can just make a better experience for people in vulnerable times. So
Yeah. And so my last question for you is, what are you listening to now? Like what's on your playlist?
Oh gosh. Oh my goodness. So I love house music.
Yeah.
That's my
Oh my
main
God.
thing.
Okay.
And anything electronic in general, but even within the electronic genre, house music is my thing.
Yep.
And if it's not house music, if I want something more chill, it's just like the whole chill genre in general.
Okay.
And within house music, if you were to ask me exactly right now what I'm very much into, it's just Afro house. So yeah.
Yeah. As of
So
2004, November 4th, that's what you're into.
yeah,
Okay.
so as of today, yes.
Great.
If you go into my Spotify like
Yeah.
playlist, it's a bunch of Afro house right now. So
Excellent. Excellent. Well, thank you again so much. This was great, and hope to see you soon.
sounds good. Agreed. I'll see you at our next conference then.
Yeah. And thank you to everybody who's listening, and feel free to reach out if you guys have any questions.
Thank you for listening to this podcast episode from HSS Presents, a ConveyMed production. And keep listening to HSS Presents for other offerings. The views expressed on this podcast are those of the interviewers and interviewees alone and do not reflect the views of HSS. Information relayed on the podcast is for informational and educational purposes. This information is not medical advice and should not be used for diagnosis or treatment. Listeners should seek advice from a licensed medical professional before making any personal healthcare decisions.